Peace Corps response sort of found me. I was doing some work in India and received an email from a listserv I belonged to, and it mentioned this particular position in Malawi. It was focused on HIV and AIDS, and that's my background. So it was a perfect opportunity. I was looking for an opportunity to come back to Africa, so I applied. I think in the 1980s, when I applied to Peace Corps then, I'd already been to graduate school, did my master's in public health. I already had a number of years of professional experience in nursing, and I was looking for another opportunity to see another part of the world and to apply the skills that I had. My role as a Peace Corps response volunteer was to provide technical assistance for that at a local assembly. I was in Lilongwe, which is the capital city, so I worked at the Lilongwe District Assembly, assigned to work with a counterpart within that assembly, who is the Director of Planning and Development, and would work on assignments that that counterpart gave me. Well, it's being in the right place at the right time. It was perfect because I had been in Malawi as a Peace Corps response volunteer, and because I had worked in local government, I understood enough about the systems that support HIV and AIDS prevention, treatment, care, and support in the country that I could be of use to the Malawi Defense Force. It would have been much more difficult had I come as an outsider. I read a book many years ago when I was working on my master's degree in public health called Man Adapting, and it was really fascinating to read about the adaptability of the human species and how we really can adapt to situations. And as a Peace Corps volunteer, you have to remind yourself of that all the time. You can adapt to this situation if you let it happen. And you have a responsibility to make it work. And don't fall back on Peace Corps and say, you need to make it work for me. But it's our job.